surgeryandmedicine.com, your med school in your pocket.
Hi, in this demonstration we're going to show you how to do an arterial blood gas sample. Now, the reason that we do an arterial blood gas sample is to actually get an indication of how much oxygen we're getting into the arterial system and how well the lungs are working. The arterial blood gas samples can also be processed very quickly and give us very important information such as the pH, the amount of oxygen, the amount of carbon dioxide in the system. So we've got a basic setup here which we'll pan in close on. Okay, now arterial blood gas syringes can be different in different hospitals. There's lots of different makes. This is a pre-filled heparinated syringe. So we've got some heparin actually in the syringe, and that'll stop the blood from clotting. And then we've basically got two different types of stopper device and two different needles. Now, the arterial blood gas samples are taken usually from the radial artery, just at the wrist where it's very, very prominent. And this can actually be a very uncomfortable blood test. But because it's very close to the surface, we tend to use the smallest needle that we can. So to set this particular setup up, we unscrew the syringe. We need to actually eject the heparin, so we'll do that just onto this towel. Attach it to the needle. As we've said, we're going for a very small needle. As you'll see with this one, it's actually very, very fine indeed. And then you need to withdraw to about 1 ml. Now, depending on the type of arterial blood gas syringe you're using, some of these will fill automatically as soon as the needle is in the artery. Others, you'll have to actually withdraw the needle to get the arterial sample. The difference between an arterial and a venous sample should be obvious to you when you take the blood. You get a pulsation with the arterial sample, so if it is a pre-filling syringe, then it will pulse as it goes up, and the blood that you get back looks distinctly different to the sample that you get from a venous sample, in that it's much, much brighter because of the amount of oxygen. Now, once you've finished with the syringe, you can, with this particular needle, you can either pop it into this cork here, or you can screw this on the top instead of the needle, so unsheath the needle and screw that back on. So we will demonstrate how to do an arterial sample at the wrist now. Okay, when you take an arterial blood sample, first thing you need to do is the same as with all procedures, is introduce yourself, gain consent, make sure that you've got the correct patient. Now, for an arterial sample, I would actually warn the patient that this can be an uncomfortable procedure, considerably more so than taking blood, and prepare them that when the needle goes in through the skin, that it will actually be a little bit painful, but they need to just bear with you as best they can so you can get the sample. Now, you take an arterial sample from the same place that you feel the radial pulse, and what you need to do is, if you ask the patient to cock their wrist back, and you just have a good feel for the pulse, and you can feel along and feel wherever you feel the pulse is most prominent, that's where you then want to take the blood from. Now, we're not actually going to show the arterial sample at the moment. I'm just going to show you how you prep. So you get them in the right place, you get your needle. I'd come in at a 45-degree angle in the direction of the artery, pierce through the skin, and then advance the needle very, very slowly until you get a flashback of bright arterial blood, which should automatically fill your syringe. Now, you'll notice that I'm holding the syringe very differently to I would if I was taking blood from a vein for a venipuncture. I actually hold this in a pen grip, so you get some more control, and you can just advance it very, very slowly. Now, it may be that once you're through the skin that you don't hit the arterial sample straight away, and this can be a bit of a problem when you take an arterial blood gas sample, is that you have to fish around a little bit until you actually hit the artery. So you need to warn the patient that it can be a little bit slower than they might like, but just to bear with you. Once you've got the sample, you've put your needle into an artery, so you're going to need to take the needle out, press very, very hard with a cotton wool bud, discard the needle appropriately in a sharp spin, and then you need to wrap the cotton wool up with a full layer of tape and ask the patient to press hard over the artery for at least a minute. The reason for this is that you can get a lot more bleeding from an artery than a vein, and if you don't put pressure on it, it can bleed into the surrounding structures and cause a large bruise or a large hematoma. So it's important that you're aware that it's slightly different, the considerations for an artery than for a vein. So if it's okay with you, we'll proceed on and put you through some pain for the benefit of millions of viewers.
Okay.
Okay, so I found the radial artery. I'm holding the arterial syringe in a pen grip. The needle is a very small needle, bevel up. I've got Charlotte prepared for the procedure. I'm actually resting her arm on her leg so there's not much movement. I've got my gloves on for protection. And Charlotte, just want you to bite your lip now. Okay, we can see that this is filling. It's actually filling quite slowly. But we can see the colour is obviously arterial and that the syringe is actually getting pushed out. So we know that there's arterial pressure in the syringe that's allowing this needle to fill. Now, we were very lucky to get that first attempt there. As I said, it can be a little bit more difficult to actually get it into the right place immediately. And with all procedures, when you're getting blood, once you're through the skin, that's the most painful part. So Charlotte, I'm just going to withdraw this needle now. Okay, that's bleeding a bit, but I don't want to put my hand anywhere near that needle. Okay, we'll clear that up afterwards. Discard the sharp needle and put the tip on the arterial syringe and go and get that sampled. And then they collect automatically.